talked about, as Dr. Rowe mentioned earlier, interesting is that we do colonoscopies, at age 50, and that's true for U.S. population. If you look at the incidence of stomach cancer for Korean Americans, we are about equal rate in terms of colorectal cancer rate and stomach cancer rate. So, as a Korean Americans, we go for colonoscopy, but we, as Dr. Rowe mentioned earlier, we should definitely go for endoscopy because our rate of getting colon cancer rate is same as our rate of getting stomach cancer. And that's obviously different than U.S. population. So it's very important when you go for colonoscopy, make sure we get endoscopy, as Dr. Rowe mentioned earlier. The other mention is, how about is sort of briefly talk about China study. China study is a book I brought a copy here. It's published China study by Professor Campbell, professor at Cornell University, who did a lot of study in incidence of cancer in China compared to the U.S. population. Why is that? The China studies found a similar finding as Korean American. The incidence of cancer in China was a lot lower for breast, endometrial, ovarian, as well as prostate, colorectal cancer. As Chinese Americans come to U.S., their incidence goes up as we see in Korean American populations. So what they're doing was that genetics usually doesn't play a major role. Even though family history is important, maybe 5 or 10% of the cancer is genetics, but rest of them is environmental. Means lifestyles, food, as well as Dr. Hume mentioned diet and exercise. In China, as well as Korea, the people eat a lot less amount of protein, particularly animal-based protein. They eat a lot of vegetables, fruits, and if they eat protein, they are usually plant-based proteins. In the United States, obviously we eat a lot of meat here, and the high protein content, as well as a lot of them from the meat. And that seems to be the major role in increased incidence of colorectal cancer, as well as prostate and breast cancer. Weight control. Weight tend to be higher here, and so as Dr. Hume mentioned, and there's clear data show that even for patients who are diagnosed with breast cancer, if you exercise 4 times a week, 35 minutes a day, and they lower the risk of recurrence of breast cancer. So weight control, diet, exercise is very important. Environment was talked about. And virus, we talked about the H. pylori, viral infection, as well as hepatitis, all need to be screened very carefully. So in terms of Korean American males, we talked about family history. Make sure you tell the family when you see a primary care doctor about your family history. If you have any family history, stomach cancer, colorectal cancer, they change the age of screening. It's very important to talk about family history. If you don't know, we have to go and ask the family history. Colonoscopy, appendectomy we talked about, and doing annual stool test for the blood, as well as a prostate-specific antigen for prostate cancer. Since, as you know, prostate cancer incidence goes up among Korean Americans. Obviously, no smoking. About 30% of all cancers relate to smoking. Lung cancer, pancreatic cancer, even high incidence colorectal cancer has been noted. And also, obviously, check for hepatitis B, as well as C and H. pylori infection. And for female, breast digital mammogram and self-breast exam, pelvic exam for pap smears for cervical cancer, as well as ovarian cancer check, colonoscopy, appendoscopy for stomach and colorectal cancer. And also the smoking, as well as checking for hepatitis and B is very important data. So I'm just going to briefly talk about it in Korean just for what we talked about that. 제가 한국말로 잠깐 하겠습니다. 여기서 아까 보셨지만은 한국에 계시는 분들은 특히 이 위장암이 많이 되는데요. 70명이 되는데 여기 미국에 계시는 한국 분들은 위장암 수가 반으로 줄고 특히 미국에 있는 다른 미국 분들은 더 줄은데 특히 미국에 오신 분들은 이 프로스테이트 캔서나 이 스토막 캔서 레이션이 달라져요. 스토막 캔서 레이션은 더 줄고 프로스테이트 캔서는 많이 되고 대신 대장암에 더 미국에 계신 한국 분들이 더 이 암이 많이 생겨요. 여자분들도 보면은 이 미국에 있는 미국에 있는 한국 분들은 이 브레스트 캔서나 특히 콜레스테롤 캔서가 더 많이 생기시고 또 한국에 계신 분들은 이 위장암이 더 많이 생기거든요. 그러니까 여기 대부분 오시면 미국에서 이제 이민 오시면서 음식이 바뀌고 라이프스타일이 바뀜으로써 이런 암의 이 종류가 바뀌는 거죠. 그러기를 위해서 많이 이제 검사를 하시고 특히 이제 음식을 조심하시고 한국 음식이 좋잖아요. 닥터 로켓한테 말씀한 대로 김치도 좀 많이 드시지 말고 적당히 드시고 채식을 많이 하고 운동도 중요하고 그 다음에 담배도 안 피시고 그런 걸 조심하고 특히 이제 헤파타이티스 그 간염이나 그 H. pylori 같은 걸 검사하셔서 그 주치의한테 가서 검사 꼭 하시고 그럼으로써 하면은 모든 이 한국 분들이 건강하시고 근데 대부분의 한국 분들이 이 미국 분들에 비해서 암이 한 반이에요. 근데 한국 분들이 굉장히 건강하신 거죠 그런 분으로. 제가 보기에는 특히 이제 음식이 많이 한국 음식이 좋으니까는 그런 것 같아요. 그 다음에 다른 것보다는 이제 모든 걸 검사를 하시고 제가 나중에 또 패널 디스커션 때 특별히 암에 대해서 질문을 그때 하시면 되겠습니다. 그 다음에 또 중요한 게 이 American Cancer Society의 Asian Initiative라고 한인하고 중분들을 위해서 따로 그룹이 있어요. 그래서 만약에 필요하신 게 있으면 예를 들어서 이 트랜스포테이션 필요하거나 무슨 어떤 데에 대해서 알고 싶은데 한국말을 하시거나 그러면 그쪽에다 전화하시면은 거기서 직접 트랜슬레이트 해주시고 모든 필요한 서포트가 필요하니까요. 그 아메리칸 캔서 소사이티를 통고 그렇지 않으면 또 저희 KCCP 헬스케어 커뮤니티 다운로드 테니까 저한테 이렇게 말씀해 주시고 그렇게 하면 감사합니다. 네, thank you very much.